So now let's say we have a medical practice. If we were able to give him a medication or therapy that required further visits, wow. It's weird for me to think, because my whole goal with chiropractic is to reduce visits. You know, we go from, whatever, 3 or 2 or 1, to get you healthy so your body is healthy so you don't require it. Their job, particularly with blood thinners, you have to go in for regular tests to make sure that the blood's not too thin or too thin enough or too thick or whatever. Blood pressure drugs. Do they check you if you're on blood pressure drugs? Yep, every visit they ask you to come back on a regular basis, not just to fulfill the prescription, but to see how your body is. Now what's interesting is your body's self-regulating and self-healing mechanism built by God.
Yes, it is.
Yes, it is. So if you have blood pressure that requires up here, and you decide to force it down, taking a diuretic or a beta blocker, what do you think is going to happen 3, 4, 5 months? Do you think your body's going to adapt to that?
Yeah.
Yeah, so how many people are taking 1, 2, 3, 4, 5 blood pressure drugs? Yeah, so I mean, guaranteed business. Antacids, we already know that if you take those, you're going to require more of them. Statin cholesterol drugs, heck, those damage livers. We know they damage the liver. In fact, we're going to test quarterly to make sure that you don't have any liver problems. And none of these drugs go after the source of it. Now, the snake oil salesmen, what's wild is you're guaranteed to develop the effects of the medications. I shouldn't have put side effects up here, that was my bad. Okay, so what's the effect of cholesterol lowering drugs? Yes, we know it lowers cholesterol, we know it causes heart disease, we know it causes cancer. Okay, what's the effect of migraine drugs, headache drugs? We know that they cause nerve damage, depression, and more headaches. What's the effect of asthma drugs? We know they lead to heart attack and a stroke. Okay, and 4,000 to 5,000 people die every year from asthma drugs. I mean, 5,000 people a year die from asthma. 4 of those 5,000 die from the medications. Arthritis drugs, fungal infections, cancer, joint pains, antidepressants, one of the most addictive drugs on the planet, but they say they're not addictive, but antidepressants are addictive, and they cause depression. Wait, did I just say antidepressants cause depression?
Yeah.
Okay, now imagine all of this stuff goes in the esophagus, in the stomach, mixed with that acid, into the bloodstream. Wow, that sounds crazy. So what we're doing, people are becoming aware. The distribution arm of the largest industry in the world, the pharmaceutical industry, we're starting to get smarter. We're starting to think, wait a second, maybe we should take care of ourselves. Maybe we should keep our pool clean instead of waiting for fungus to develop. Okay, maybe, and it's called the era of pre-symptomatic medicine, which sounds crazy. We should call it health or wellness care. So, when somebody says, should I bring my kid in to get their nervous system checked? I said, no. Wait till they get major symptoms. Okay, that sounds dumb too. Should I take up smoking? Yeah, go ahead, take up smoking, but stop when your lungs bleed. No, we don't do dumb stuff like that. Yeah, you can eat fast food, eat McDonald's, every day until you get kidney and liver damage, then you can stop. No, we start taking care of ourselves. Now, this is how we take care of ourselves. Your body, you got certain parameters. I mean, having this case that holds an undying soul, it's really neat. It lasts 120 to 150 years. But you got certain design parameters on this human frame. You have to put soluble fibers in there. You have to have heavy plant fibers. This, greens, has lycoprenes or luteins. Now, luteins are loaded with anti-cancer properties, and they actually clean the arteries out. They lower your cancer risk, they lower heart disease risk, and all you need to do is eat this stuff daily. Oh, that's easy. And the reason is, when you eat food, remember, it goes in the stomach. Right next to the stomach is the duodenum. Now the duodenum, remember, we get really acid in the stomach. It gets the duodenum, it gets a little bit less acidic. In the duodenum, calcium and iron are absorbed. So does this mean anybody taking antacids gets calcium deficient and iron deficient?
Oh, yeah.
Yeah, I'm sorry. What does calcium deficient and iron deficient do? We're talking depression, osteoporosis, muscle aches, joint pain, cardiac arrhythmias, and low energy. That's okay, we got pills for those. Okay, but okay, can you see it's kind of crazy there? Now, I actually had a patient who said, oh yeah, my son with attention deficit disorder, we give him calcium, every day. And I said, wow, cool, what form? Well, we give him a Tums. Okay, now, you've seen the advertisements, okay, and they're really clever. Okay, what do you want? Rollates with aluminum salt or Tums with calcium? And calcium is what your body needs. What they don't tell you is by decreasing the acid, not only do you get calcium deficient, you get iron deficient too. And you're given an attention deficit disorder kid this? Okay, so then the food moves through this and gets less and less and less acidic. So as it goes through, there's a tremendous amount of surface area and different nutrients are absorbed there. Now, let's say we had no morals and ethics, and we actually lived in a society that decided to produce unsafe, toxic products and put it on a shelf and call it food. Okay, now, I know what you're thinking. I know what you're thinking. You're thinking, well, won't bacteria eat it? Okay. Well, yeah, but let's take away the nutrient value from it. We'll add preservatives, eliminate the heavy fibers, okay, the stuff that bacteria would eat. That way it'll add to the shelf life. And you might say, well, God, wouldn't that cause disease? And you'd be right, it does, it's poisonous. But it adds to the shelf life. So we can make a tasty product that lasts a long time so we can make cheap food products. I know they're poisonous, and so if we label them correctly, yeah, our FDA is not doing too good a job. Heart disease spread, acrylamide trips, colon cancer docs. Let's say we put a chemical in there. Now this is brilliant. MSG. Have you ever heard of this?
Oh, yeah.
Now, some people are getting educated on MSG. Okay, they know that it's a central nervous system toxin. It's an excitotoxin, which means it causes nerve damage, weakens the immune system, and can cross the blood-brain barrier. It's very, very toxic stuff. But the reason it's really cool, because remember, we're talking about capitalism here, we're not talking about health. The reason it's super cool is that you eat it, it tastes really, really good, and it shuts down your body's ability to realize that it's full. So if we can mix MSG in any of these food products, not only will you be able to keep eating them, it's going to give you a rush, like almost a chemical high, kind of like an endorphin or morphine-like high, and we can sell more products. So this, I included in your handout, are the different names that we can fool the educated public into not realizing that MSG is inside of the health bars or inside of the packaged products. Let me tell you right now, nearly everything that you get in a package, including the granola bars and everything else, has an excitotoxin called MSG. Do you think, by the way, putting a chemical product in a food, do you think that might cause the body to not digest it correctly?
Yeah.
Okay, good, just checking. So now, anything you eat has to go through these veins, and these veins go up into the liver. So if you put, let's say, the most powerful anti-cancer agents on the planet, such as lycoprines, which are found in red fruits and vegetables, particularly in tomatoes. Let's say that you ate this stuff daily. Oh my gosh, what would be the result? You'd have soluble fiber, you'd have heavy fiber, everything would work right. So that means the food that comes through the stomach goes through the duodenum, into the jejunum and the ileum, all the way through, and then all this food dumps out into the colon. That's all plant products or healthy animal products. Do you think that your body will be able to recognize it and process it correctly? I think so too. That's a great idea. Now what happens is have you ever heard of diverticulosis or diverticulitis? Well, diverticulum means or diverticulosis means a condition of. Now the colon is a muscular tube, okay, and it moves in what's called a peristaltic wave, where it's literally going to flow that food down, okay, but it has certain functions. Because remember, next to the stomach, calcium and iron are absorbed in the duodenum. As you get further down, inside of the colon, most of the water is absorbed. So now, let's say you're dehydrated. Let's say you don't drink enough water. Let's say you're not blessed with Minnie and Maribel, who yell at me if I don't drink enough water. Okay, it's a pleasant irritant, I appreciate it, and I'll let you do it out of love. Okay, but now let's say your body is going to hold on to that food if you're dehydrated to suck the water out of it. So that gets thick. Or let's say that you have food that tastes good and has a long shelf life. That means it's loaded with preservatives and it's toxic to your system. It doesn't move through the colon really good. Let's say that you sit. I know it seems crazy, but